Each time a man stands up for an ideal, or acts to improve the lot of others, or strikes out against injustice, he sends forth a tiny ripple of hope, and crossing each other from a million different centers of energy and daring, those ripples build a current which can sweep down the mightiest walls of oppression and resistance.
These words inspired the creation and growth of a nonprofit free psychiatric clinic in Salt Lake City, Utah, that provides completely free care to individuals who are poor, are seriously mentally ill, and have no health insurance. The clinic has grown and has become a critical part of a network of services provided at a time of exploding need. It is now capturing regional and national attention for its innovative approach to a difficult and even intractable problem. So how did this clinic come to be? The founder, Dr. Noel Gardner, says that it was born out of crisis and necessity.
So I don't know whether you'd say starting this clinic was an accident or maybe a miracle or maybe some of both. I had done many other things with my career, spent 15 years on full-time faculty at the University of Utah and loved working with residents and medical students. But then my life changed. I did many other things for the next 20 years. And then I had the opportunity to work with students and residents again. I was invited to be the medical director of a very busy, large community mental health center where residents routinely rotated, and I had 4 or 5 of them at any given time. I was there for a year and a half when suddenly this wonderful community mental health system lost their Medicaid contract with the state, and patients, doctors, clinicians, staff, many of them fled and left as they were unable to provide services. The university pulled the residents out, and there I was in a clinic, unable to manage the overwhelming needs, and I'd lost my residents. I too left. And after a while, I really missed treating severe persistent mental illness. And in that moment of crisis, decided that I'd start a little free nonprofit clinic to treat patients who had no insurance and very little income, hoping to someday get residents and students back where we could meet both needs, the need of the patients, but also the need of the students and residents for a training experience in working with these patients.
So how does the clinic work in practice? For a few minutes, let yourself be a patient. You arrive and walk toward the clinic. Perhaps you have never sought mental health treatment before, and you are apprehensive. Perhaps you have had painful previous encounters with crisis and mental health services. You may know that you need help, but may be frightened by how psychiatric treatment has sometimes made you feel. The desperation you feel that your illness will cause you to lose your job, your ability to pay rent, and your fear that your whole family will soon be homeless overcomes your ambivalence. You swallow hard. With a trembling hand, you open the door. You are met by Robert, the bilingual receptionist, who welcomes you warmly. He's been told that he is the most important person in the clinic because this meeting is the last chance for the clinic to make a good first impression, and that this is crucial. You move to a seat in the waiting room, where you see the gratitude corner, where previous patients have left their messages, thanking specific providers or volunteers or the whole clinic for the help they have received. You can almost hear their voices speak directly to you.
Thank you for providing an environment where I can feel safe and can receive treatment despite my difficult situation.
Thank you for explaining exactly how I feel and understanding exactly how I feel when no one else has been able to.
I know that if I can push myself to come to each appointment and get the help I need, I can do anything.
Next, you meet with an intake specialist, a volunteer who spends an hour listening with interest and kindness to your story. She then reviews all the potential issues you face: housing security, food security, and transportation, and then provides referrals where you can get help for each of these needs. She then steps out of the room, and a few minutes later, the supervising psychiatrist arrives. Dr. Gardner has reviewed your history and asks a few more questions. He says that he would like to start helping you right away and suggests that you accept some samples that he says are likely to quickly improve your anxious insomnia and quiet your paranoia. He selects the appropriate medications from a large set of branded medication samples. You are then scheduled with a psychiatric resident for a full psychiatric diagnostic evaluation in less than 2 weeks. You leave the clinic amazed at how quickly you received the very help you need. You feel a sense of hope beginning to come over you. You are feeling better already. Impact Mental Health was not always like this. When the clinic started, it was much smaller and certainly was a tiny ripple of hope, with the emphasis on tiny.
So the very first clinic started in the fall of 2012. I had a good friend who had a couple of empty offices in the basement of his clinic, and another friend who is a psychiatric nurse practitioner, Paul Olafson, joined me in treating the very first patients for free in the basement of this clinic. We didn't have any staff. We put together our own charts, and we began seeing patients every Monday afternoon. Fairly soon we were able to get a few volunteers to help us. We hired our first office support person for $10 an hour for 10 hours a week, and we had begun a clinic. I then reached out to the Department of Psychiatry and was able to get one resident who spent one semester rotation with us, but she was terrific. And right behind her came more residents. By 2013 and 2014, we had 4 residents who spent at least a half day each week in the clinic. We were able to see more patients. We got our first real grants, and the clinic was beginning to move. Then we had another crisis. The Department of Psychiatry announced that we had to come up with the money to pay their prorated stipends and benefits, and we simply didn't have that kind of money. They pulled back those residents, and we were again in crisis. In that gap stepped a wonderful rescue.
I saw this as a unique opportunity not only to have much needed direct services for our county residents who had funding gaps, but in addition to that, and very important, to give prescribers the opportunity to work with someone with Knowles' training and experience to be able to learn and how to manage the psychotropic medication regimes for very complicated cases. I can't say enough about what this Impact Mental Health Center does for our community. Dr. Gardner is an amazing man with a lot of passion to help individuals and to also train. He's an exceptional educator, and I think this is an opportunity that has benefited Salt Lake County in a very large way.
The real strategy of the clinic was coming into focus. The strategy was to identify and partner with other important mental health and training organizations who shared this mission. That is, to identify other centers of energy and daring, and to expand the impact and magnify the ripples of hope. First was solidifying the partnership with the residency training program at the University of Utah. With Salt Lake County support, the resident rotation in 2014 to 2015 became very popular and has continued to grow. Listen to Dr. James Morris, Chief Resident at the University of Utah, as he talks about the resident experience.
And I've had the opportunity to spend just over a year working at the Impact Mental Health Clinic, which has been one of the most rewarding experiences that I have had during my psychiatric training. The patients that frequent the clinic come from all walks of life, and most of them are very impoverished. Sometimes they are refugees from their own countries, some are recently released from prison, and most patients have very little social support and come to the clinic really reaching out for any help that we can offer.
Next was a partnership with the University of Utah College of Nursing, with the first nurse practitioner student in 2016. Knowing the particular importance of psychiatric nurse practitioners for community psychiatry, this was another center of energy and daring.
Impact provides each of us with an opportunity to be part of something that is bigger than oneself. Each life impacted sets forth its own ripple of compassion and courage. the courage to stand for impactful mental health services for those in need.
But as the clinic grew, so did the mental health crisis. Now it was not just Salt Lake County, it was the whole state of Utah. An in-depth analysis of the current state of mental health in Utah by Laura Summers and researchers at the Kem Gardner Policy Institute at the University of Utah made disturbing front-page news in 2019. The report documented very high rates of psychiatric illness and suicide, and a troubling shortage of mental health providers. It quoted a Mental Health America study from 2018, scoring states in the U.S. regarding the prevalence of mental illness and the availability of mental care services. On adult measures, Utah ranked 51st behind every other state and the District of Columbia. In addition, it projected that the shortage of clinical providers will only become worse in the future. Then, the potentially biggest mental health crisis in U.S. history was created by a national and global pandemic. The vast number of people ill and dying was horrifying. The number of people who lost their jobs, and thus their insurance, portends an enormous crisis of bankruptcy, homelessness, hopelessness, suicide, and cross-generational grief and despair. Suddenly, the social determinants of health became relevant at a level never before seen. Into this moment of crisis, a new partnership emerged. In the late spring of 2020, just as the pandemic started to rage across the country, Impact Mental Health entered into a partnership with the University of Utah College of Social Work, as 13 social work students, along with their faculty supervisors, were assigned to do their community practicum placements with Impact. They did intakes, proactive case management, and disposition planning with Impact patients. This added a tremendous set of critical services that patients desperately needed. Dr. Martell Teasley, Dean of the College of Social Work and President of the National Association of Deans and Directors of Schools of Social Work, gave full support behind this critical addition to both our service provision and to our multidisciplinary training. Now, a larger strategic vision becomes possible. Impact Mental Health is building a network of connected partners tied together by service for underserved individuals with serious mental illness and no access to care. It serves as a diagnostic and treatment hub with spokes to hospital emergency departments and inpatient units, spokes to other nonprofit clinics and agencies, all connected to the clinic by social work students who facilitate patient services as navigators of a previous system that was fragmented at best and often non-existent. So, what is the impact of Impact Mental Health?
I think the main impact that Impact Mental Health is and has is the extraordinary life-changing experience that students and residents and volunteers have as they encounter the lives of individuals who have been so damaged by life and who come with their illness. And in that experience, the patients' lives are changed, but the lives of those students and residents is also changed. It is a transformational privilege to work with people in this setting.
And where is the impact?
This wonderful logo tells a tremendous story. That logo was created by one of our volunteers as a gift to our community. And if you look closely at that, you can see almost all of the elements of what happens here. You can see this torrent, this almost hurricane of suffering, the dark blues of depression, the bright oranges of anxiety and the terror of mania. But around that, we can also see that this is a circle, almost a mandala, at the middle of which is really the impact. And that is, it begins to create that impact of a ripple that begins to change a life. And that ripple connecting with other centers of energy and daring start to become this wave, this current. And right at the middle is where that impact is. If you look closely at the logo, you will see the face of a patient. And it's the impact. That's where the impact is made. In the one-to-one connection that happens with each of our staff, with our students, with our faculty, with each of those patients. That's where the impact is made.